Okay, so I recently had my yearly physical and my PSA numbers were a little bit high. And I've talked about this with some other guys around my age, and nobody really wants to talk about it. So instead of keeping it quiet and kind of pretending like it's not a problem, I thought maybe we'd talk about it here and maybe I can help some other guys that find themselves in the same boat. So come along and see where I'm at in the journey, and maybe I'll help you save yourself a lot of pain later. So I'm pretty good about going to the doctor every year. Like I try to get my physical. I don't want anything to catch me off guard. So I go every year and I usually talk to the doctor about anything that's troubling me or bothering my wife, whatever she tells me I have to talk to him about. I do that too.
He's married to a nurse, so it's like part of the requirement. Have to go to the doctor yearly.
Right. So this year I went in July for my regular physical and I always have lab work done,
Mhm.
and my PSA levels were higher than normal. So a little bit of backstory: in 2017, same thing. I went and had my levels checked, and my PSA level was 4.4, and apparently that's too high. So in 2017, I ended up having to have a biopsy of my prostate, and that was not fun. And if you've had one, I know you're going to agree with me. Not fun. Not going to describe it in detail, but yeah, it just wasn't fun. So, but nothing. The results of it came back that there was no cancer in my prostate. So the
Which was
doctor,
great.
yeah, the
Hmm.
doctor at that time said, then you should just consider 4.4 your normal.
Hmm.
So I took him at his word, and that's what I've been doing. So a little bit of research I've done, I found out that basically 12% of all men end up with prostate cancer at some point in their life.
Right.
And if you're above 50 and your prostate level is between 4 and 10, you have a 1 in 4 chance of developing prostate cancer. If your levels are above 10, it's 1 in 2
Two.
chance, 50%
Hmm.
chance of having cancer.
Hmm.
So when he told me that 4.4 was my new normal, I'm like, okay. My regular primary care physician here didn't say that's not right. And
Right.
so basically, for the last 4 years that I've been here in Kansas City, it has been hovering in around 4 point something every time I go.
Pretty much in the same range.
Yeah,
Hmm.
every time I go to the doctor.
Right.
This time it went up to 5.87, so almost 6. And my primary care physician said basically, come back in a few months and we'll recheck it. Well, one of the things that I had mentioned to him while I was in conference with him was that I'm having another issue. It's called Peyronie's disease. I'm really not going to get into that here. So for all of you that go out there and look that up on Google, you'll understand why I don't want to talk about it. But me bringing that up to him had him make me a referral to a urologist to talk to the urologist about that. So I say all that to say we went to the urologist last week,
Hmm.
and for a follow-up visit about the Peyronie's disease.
So, me being the person that I am and the wife that I am, I insisted upon going to this urology appointment with Rich. He did say, yeah, that's fine, but he laid down the law pretty thick that I was allowed to go if I promised I would not speak.
Not exactly not speak. So, and again, I'm really just trying to help other guys that find themselves in this
Absolutely.
situation.
Yeah.
It's not super comfortable to talk about, but
Right.
you know what? It just is part of being a guy in your 40s, 50s, and 60s,
Right.
right?
Right.
So, what I told Robbie was, you can come along, but let me be a man.
Yeah.
And that sounds really crappy, and she's really good about that normally, but when you're talking about your nether regions with another guy, you really don't want your wife like chiming in on things that you might have missed. So, and that's Robbie would do that out of loving and care. She would say, hey, you forgot about this or whatever. So what I told her was,
Yeah.
unless I forget something, you're just there to listen. basically, right?
You're there for just support. Yes.
Right.
Which I was glad to do. I totally understand where he's coming from. This is a very personal, private kind of a thing. And yeah, so I just was glad that I was there. And we did have a very good conversation with the urologist.
Right. So we talked about the reason I went there, and then I just mentioned to him that my PSA level was a little higher than normal, and he asked me for the number, and I told him it was about 6. And I also told him that I'd already had a prostate biopsy, and at that time it was 4.4, and there were no problems, and the doctor said that's my new normal. And this urologist went,
No.
that's not right, and basically started me on the process of getting it checked out. Well, I also described to him some of the symptoms that I'm having that are related to an enlarged prostate. So, and I know many of you have these,
Right.
and this is the heart of why I'm doing this video. If you are getting up a lot more often, especially in the night to go to the restroom,
Yeah.
if you don't feel like you're emptying your bladder when you do go, if your urination flow is much weaker than it's ever been, or it continues to get weaker and weaker,
Takes
or
longer for you to pee.
yeah, it's just taking longer for you to get done, or if you're starting and stopping,
Right.
those are all things that indicate an enlarged prostate. Now, an enlarged prostate doesn't mean that you have prostate cancer.
Right.
And let me just caveat this now. I'm not a doctor.
Yeah.
I'm just a dude who is going through everything that 50-something-year-olds go through. So I described all that stuff to him, and basically he's nodding his head the whole time saying, yep, that's what happens when you're starting at age 40. All men's prostate starts to enlarge. It's just a matter of how they deal with it, and genetically how big it gets and how much of a problem it becomes.
Right.
So I got to say that it's not a huge problem for me. Like, I did a pre-visit questionnaire, and the questionnaire asked me if these symptoms didn't get worse, would you be fine with it? And I said, yeah. I mean, it's not so bad. Like, I'm not getting up. I don't get up every night. I'm not having to stop on a road trip and go to the restroom all the time. So it's not horrible.
Right.
But I described all that to him, and he's like, yep, those all have to do with an enlarged prostate. That combined with your elevated PSA levels, we're going to have you do what's called a 3T MRI.
I think he was mostly concerned more about not your symptoms, but because of the
elevated PSA. Yeah.
So in doing that, in saying that, he obviously wants to investigate further to make sure that there is nothing else going on other than an enlarged prostate. So
it's some special MRI that you go to, and it's a relatively recent or new procedure. It's also called an MRI prostate fusion. Right. So there's different terms for it, and it doesn't sound like it's going to be super fun. It's not going to be painful, but the way they do the test, if you wanted to look it up, you'd understand what I said. The way they do the test doesn't sound like it's going to be real comfortable, but apparently it lets them determine whether they need to do a biopsy to check on whether there may be cancer. So they're better able to detect the early signs of cancer and determine whether they need to actually go in and do a biopsy.
And with that being said, since Rich has been through a biopsy before and knows what it feels like, one of the things that the doctor said right away was, we don't do it like that anymore, which I think was a real relief to you. There's sedation that goes with it now versus...
Yeah, they just numb the area when they did it for me. And let's just say that numbing effect didn't do a lot for the process. Okay, all that being said, so we're in the process of scheduling that 3T MRI right now, and I'm supposed to go back in a month after he has the results of that and determine what next steps are, if we're going to do biopsy or whatever it is. But also in the meantime, he wants me to start taking tamsulosin, which is a drug that is supposed to help reduce the size of the prostate, so it allows all those things to do with urination to go back more to normal.
Yeah.
It also has some side effects. And again, why I'm having this conversation, I'm going to put it out there for the world, is I think we as men have this interpretation that if you start going to talk to a doctor about your prostate, they're going to make some recommendations that says, well, you might as well give up your sex life.
Right.
Right. And this doctor basically said that's not true.
Right.
And it continues, the prostate health process continues to get better and better, so that they have different ways of treating. Even if you do have prostate cancer, there's different ways of treating it, so that may not be the outcome. But the long and short of it is, whatever is discovered in this, I want to catch it as early as possible,
right,
so that I have the most likely chance of being able to carry on a normal life, including a normal sex life,
right,
going forward.
right.
The longer that you wait or that I wait, and a disease may progress, obviously the more invasive the treatment has to be, and the more likely you are to have
side effects.
Yeah, and sometimes debilitating side effects, right? Like,
right.
Things won't work like they're supposed to.
Right.
So, this is a topic that guys don't want to talk about, right? As a matter of fact, we were sitting down with some friends of ours just last night.
Yeah.
And I'm talking about doing this video, and they're saying, yeah, you should do it, because my friend's saying, I don't want to talk about this stuff.
Right.
So, but it's stuff that we all need to hear.
Right.
And then the woman who was in this couple last night, she has been through breast cancer. And she basically said, someone needs to take some steps to normalize this, so that guys don't get caught off guard with this disease and then wait too long, and then they're not able to be treated. So again, I don't know that I have anything wrong with me, other than the normal prostate is enlarging as I get older.
And I think we however this plays out, I think you feel very comfortable with continuing to, as things go along, if there's things that do occur and do happen, and we are going to let you know and keep you posted, just because we want to help other people that are going through similar things. And so you're making the choice to be transparent and just open and honest about this, even though it's kind of uncomfortable. And I'm very proud of him for doing that, because I know it's not an easy thing to talk about. So that's really our main goal in all of this.
Yeah, I mean, we've done our videos recently have been around all the kind of positives about this stage of our life, preparing for retirement. And we've spent a lot of time talking about your health as you get ready to go into retirement. And this is a big part of it for guys.
Yeah.
Like, prostate health is a big deal. And I'm sure I'm going to get comments about, you should be eating this and you should be doing that. All well and good. Bring on the comments. I'm fine with that. But I'm also going to follow my doctor's advice, and we'll track that process. And I will. I'm hoping that I continue to have the resolve to be able to share what's going on, just in the hopes of keeping someone else from saying, I wish I would have went to the doctor 5 years ago.
Sooner. Yeah. Right.
Right. So that's where we're at with this. So I know there's different ideas for treatment. There's different ideas for a lot of things. And I went to several different websites, the American Cancer Society and the Mayo Clinic, and a lot of different places checking on sort of the statistics. And like I said, 1 in 8 men or something like that develops prostate cancer at some point in their life. And the older you get, the more likely it is. So, men over 70, it's almost like there's a pretty good chance almost, right?
Right.
Matter of fact, they suggest that you quit getting your PSA level checked after you turn 70, because it is what it is at that point. I mean, not saying that they wouldn't treat it, but they're going to do other exams to check to see if you have prostate cancer. But when you're young, and I consider myself young. I'm 59 years old. Consider myself young. I don't want something, as I'm seriously thinking about going into retirement, I don't want this hampering it. And if you're in your 40s, 50s, 60s, and you're having these changes in your urination habits, or just in the way you feel in that area of your body, don't wait too long. You just don't know what it is. And I don't want you wishing again. Don't say, I wish I would have. Right. Just go get it checked out. Your doctor has heard it all. They've seen it before. They'll be able to treat you from their knowledge base. Okay. So I guess if you're seeing this and you're interested in where this goes for me, or you're getting something out of this, it'd be great if you'd like this video. Subscribe to our channel and you'll be able to follow along where we go from here, and along with the other content that we do. And hit that notification bell so that you know when we do put something new out. We put 1 or 2 videos out a week, mostly about topics related to our generation.
Yeah.
And that's where we're going to go with this. So we appreciate all of you that have been along for the ride so far. Hopefully we continue to grow the channel. And as a side note, I have a Chargers shirt on today. Typically we have Kansas City Chiefs gear on. I am a lifelong Chargers fan.
Yes,
Okay.
he is.
I root for the Chiefs except for 2 games a year, and that's when they play the Chargers. So, but we moved down here 4 years ago, and it's really hard not to be a Chiefs fan when you live here.
Yeah.
So call me a bandwagon jumper if you want. They're fun to watch, but I still root for my Chargers when I can.
And they are playing tonight.
They play on Monday Night Football this week. So yes,
great.
That's why the shirt's on. So again, thank you for coming along with us on our journey. We really appreciate you watching us and kind of making comments and being with us on this. Thanks for watching, and God bless.